Ready? I was asked to speak on how would the United States be different if we had universal health care. At one time there was a lot of speculation, but now there is proof on how it would be different if we had a single-payer system in the United States. Single-payer system means that you collect money with one entity, so everyone would pay into the system, and it's still privately run but publicly funded. And what you do is you cut down on administrative costs, that all the money going into the program is for the program. The money is used to make sure that you have adequate health care, that even though President Obama has attempted to give us access to physicals and things which don't cost anything, if there's any problem, then people are discouraged from continuing with their treatment. But there is a prime example of how a single-payer system could work. It has been working on a small scale in New York City. What happened, there was a Local 6 in New York City, which represents hotel and restaurant workers throughout the city, and they decided some years ago to go into a single-payer system. So what they did was they gathered all their money. They went to a hospital and said, we want to use you as our primary hospital, your unit, which has a number of outlets, throughout the boroughs, and we'd like to deal with you exclusively. They first said, no, we're not going to do that, and when the union said, okay, we'll have our people boycott your facilities, they soon changed their mind. So they became the hospital area that represented. Then what they did was they went to clinics, and I think they have 3 major clinics throughout the New York area. And what they did, they went to these clinics and said, we want you, we'll pay you more even to have primary doctors that spend time with the patients and take care of their needs. Because they knew that if your immediate needs are taken care of, there's less need for emergency room visits, there's less money spent on illnesses that have skyrocketed into expense because of neglect. And we hear this all the time. If you would have come in for your cancer screening sooner, we could have treated it and you wouldn't have ended up dead or whatever. So therefore we know that it works if we get early intervention, early detection. So what they did was they set up this system. They had a single-payer system, so all their employees, they weren't given a choice of going to Blue Cross Blue Shield, Health Care, Senior Plus, Advantage Plan, or anything like that. There wasn't HMOs with HAP and all that to choose from. They had one health care that was going to take care of your health care. They had one dental care plan, and they had one eye care plan. And what they did was they found out that they saved over 35% in administrative costs. Why? Because there wasn't all these different plans that their members were in. There was one plan. There was a doctor you went to for your health care. There was a doctor you saw on a regular basis that you set up a relationship with who knew you. There's prime examples where people had aneurysms or something. They were early detected, and it wasn't like they blew up and there was emergency room needs and things were taken care of, etc. So what happened was this year, that very union, those workers, received a 29% raise over the next 7 years. Why? Because their health care costs, even though they expect on a national level to go up quite a bit, their health care costs is only going to go up 3%. But keep in mind, they have a system where there's no co-pays, no deductibles, there's no barriers to you seeing your doctor. So you get your care, you take care of it. Even the retirees, they don't have a problem with that, so emergency room stuff goes down. things aren't catastrophic when they're finally discovered, but they're able to take care of it, and therefore keeps the healthcare costs down. There are co-pays for medications because they computerized, bought in bulk for their members, various medicines, etc., and they go through one area to get it done, is $5 for generics, $15 I think for name brands, but most people will go with the generics. So their cost of health and eye care is all taken care of, dental taken care of. So we have to begin to look at this single payer system does work. Now what did they cut out? They cut out insurance companies. They cut out all these clerks that argue with you about what kind of care you should have. You talk more to them than you do the very doctor who's supposed to be treating you. So we know that single payer would work. We know that we would have a healthier society based on these facts that Local 6 had. The only difference with Local 6 and what would happen with the single payer system across the country is if we had a single payer system, it would be portable. And what do we mean by that? If I belong to Local 6, I have to stay within that network because that's their single-payer system on the New York Islands. I can't very well take that up to Vermont, say. So it's restrictive, but we see it works. Most people who are working those kind of jobs won't get off the island. So for them, this is working out very nicely, except for vacations, etc. Now, I don't know how that works with their health care once in a while, if they go on vacation, but at least for your primary care, you've got a good situation if you stay within that system. And we need to expand that. We need to take it from New York and expand it across this country because, again, people can go back to asking for raises. And we have an opportunity coming up that we can begin to demand a single-payer system. How do we do that? We do that by showing up on October 6th to DA. DA stands for Demonstrate for Universal Health Care.